First up at 11 o'clock, the latest on the coronavirus here in Connecticut.
Everyone should be reassured that they will have access to the vaccine.
Some very big news on the vaccine front, and the good news is help is on the way. Hi, everyone, and thanks for joining us tonight at 11. I'm Erin Connolly.
And I'm Mark Zinni. Now, if approved soon by the FDA, Connecticut will be rolling out a vaccine by mid-December. Channel 3 Eyewitness News reporter Sharon Johnson begins our coverage with a breakdown of the timeline.
Today, we're receiving more details on the vaccine distribution timeline. Between the end of December and January 2021, healthcare workers, nursing home residents, and medical first responders will be receiving their vaccine doses. Between January 2021 and early June, critical workforce, high-risk people, adults over 65, and other congregate settings such as jails, people there will receive their vaccine doses. And then after early June, everyone else, people under 18 and the remainder over 18, will receive their vaccine doses. Although everyone will eventually get access to the vaccine, there are still a lot of people who have a lot of questions about it.
A lot of patients, they come in from the emergency room, and then it's not just that we're treating them, we're also eventually treating their family members who are also sick, and they come in as well.
Calandra Williams has been on the frontline fight against COVID-19 since March. She's a registered nurse who works on the pulmonary floor at a tri-state hospital, a ventilator floor.
We're the ones who are, constantly 13, 16 hours in the room as we're working, and we kind of see the patients more.
Healthcare workers like Williams will be the first to receive the COVID-19 vaccine, but she still has many questions about it.
I work with some healthcare professionals who are okay with getting it, and then I work with a lot of healthcare professionals who don't want to get it.
Williams isn't alone. Dr. Reginald Eady with Trinity Health New England says they've surveyed about 13,000 employees. Of those who responded, more than 60% say they'll take the vaccine as soon as it's available.
Most of the questions that, at least at Trinity Health in New England, were around efficacy, safety, and will we have to get the vaccine if we've had COVID.
The state and local health systems like Trinity Health are gearing up for education campaigns, teaching various communities about the vaccine. Manufacturers say the vaccine has a 94 to 95% effectiveness. So far, side effects have included flu-like symptoms like fever and fogginess. The Department of Public Health says people will need to protect themselves even after it's distributed as they wait and see how much of the population takes it.
We don't anticipate full vaccination, even according to this schedule, right? We're going to need to wait and see. We certainly hope that there'll be widespread adoption of the vaccine, but we're going to need to wait and see.
And once again, the vaccine will be available to everyone free of cost, even if you don't have health insurance. Reporting above the newsroom, Sharon Johnson, Channel 3 Eyewitness News.